Picture this, you're in the midst of performing CPR, fighting to save someone's life. Then suddenly, he grabs your arm. This is a moment that changes everything you know about resuscitation. CPR-induced consciousness, or CPRIC for short, is a fascinating yet perplexing phenomenon. It happens when CPR just restores enough blood flow to the brain so that the person becomes conscious even during resuscitation efforts. There's delays to CPR, there's interruption to defibrillation, and there's the emotional toll on the responders because the patient is freaking looking at you. Whenever I've seen this happen, even the most experienced doctors often get paralyzed and start questioning everything. Were we wrong? Were we just performing CPR on someone who is alive? Basically, there's two kinds of CPRIC. One is the interfering CPRIC. It's the kind where the person is moving, flailing their arms about, and sometimes grabbing your arm, pushing you away, shouting at you. All of these constitute interfering CPRIC. On the other hand, non-interfering CPRIC is slightly more subtle. It's the little movements of the arm, the blinking, the eyes tracking you purposefully, which don't exactly interfere with CPR, but still are pretty freaky. In managing patients with CPRIC, gaining control of the situation with sedation is of great importance when it comes to managing the patients or managing the people who are actually resuscitating, with ketamine being the drug of choice. It's important to note that all of this is expert consensus opinion and not really set in concrete guidelines. But amidst all this uncertainty and weirdness, there is hope. Recent studies have shown that patients with CPRIC often have better neurological outcomes and greater discharge rates. But here's where it gets interesting. There's growing research that is looking into the possibility of consciousness in patients who are undergoing CPRIC. This opens up a whole new realm of questions on the nature of consciousness during resuscitation. So CPRIC isn't just a medical curiosity, it's a complex interplay between humanity, science, and the unknown. And this leads us to a very important question. Now we know that CPRIC, or at least visible CPRIC, happens when there's enough blood flow to the brain to cause conscious movement, conscious eye tracking. But what about the patients who are not showing CPRIC? Is there a form of subclinical CPRIC that we don't know about? What do you think?